So the remit of the unit is quite huge, but what we have to do is the main objective of what the awarding organization is actually set for this particular unit is that the learner should be comfortable enough by the time we complete. You should be comfortable enough to talk about a particular country and how does the healthcare policy within that country or that geography shape what are the law and legislations which encompass or surround that the whole sector of health and social care, and then how do people actually get services of this particular policy which is set by the government. And lastly, we will look at issues which are contemporary issues in the health and social care which are relevant to that particular country. So an example here would be the unit aims to basically make you aware of how a healthcare policy works in a setting, what is the role of government, what is the role of consumers or people who actually use and avail these services, what are the factors that affect this particular policy in the sector, and then what are the typical issues from a country perspective which we have to address when we look at studying healthcare policy in that particular country. So an example here would be, if you look at England and Wales, and if you look at, say, UK or Great Britain, we look at the format of something called the Nhs Act, or which came about in 2010. But before this, the National Health Service, which is the NHS, which was formed after the post-World War II era, actually is an initiative taken by the government to create, a structure wherein healthcare services, medical services, any sort of, services which are required from a point of view of healthcare would be made available to any and everyone in the country. And this is something which is given free of cost to the citizens of UK. So we have to understand the context. That the context is that this is a context which is working within the UK. What are the policies which the government has put together and how it has shaped up over the years? What are the services which National Health Services actually provides? What are the limitations to that service? And then how does NHS today address burning issues in terms of things like dealing with the ethnic minority, dealing with problems within certain cultural backgrounds, things like the problems of when we look at sexually transmitted diseases, AIDS, obesity is a problem, heart diseases as a problem. In certain communities, this is considered too personal to be able to discuss with the GP or the doctor or within the NHS. So how do the National Health Service actually counteract and create policies, programs, promotions around it so that people are more open and they are able to take care of, make use of these services to get rid of those problems. So this is a whole context of this particular unit to understand it in a country's, in any particular country's context. And you need to have an end-to-end understanding of how everything works, what are the factors which impact it, and how this can then, or the problems that we face, what are the solutions that you can, that the government proposes, and how you can work around that is something that we need to study in this unit. Is that okay?
Yes.
Okay. Now, what we're going to do is, as the unit has 5 learning outcomes, so we'll have at least 5 or 6 sessions to cover this. And what I'm going to do today is basically start off with the first session, which is the learning outcome 1, which talks about understand the context of formulation of policy. How is we say we have NHS, we say we have policy, but how was this policy created? What is the background in terms of creation of this policy? And that is the first learning outcome that we need to look at. So I'm going to go through some of the slides, which basically will give you some background in terms of, the learning outcome 1. And at some stage, we will also discuss the handout which I've sent to you for some additional reading. Now, there's a book which is available on Moodle, which basically gives you more detailed reading on this context. And that is what I will also tell you towards the end of the session, what pages of that book you specifically need to refer so that you can develop a bit more detailed understanding on the concepts.
Okay.
Is that okay? Just give me 1 second. Just give me 1 second.
Okay.
Everything agreed with her. We will do the ILP. Content progress log, she's saying is fine. Portfolio, she's saying is fine. Assignment is fine. And then she's saying send everything to the official email. She will have a word with her. And also 2nd of October, she's in Manchester. So she will do the training for Colston Monday. 2nd of October, Monday. She's happy with the level 2 for English and maths. She said if you send us some details or numbers, the same learners could concurrently draw this funding to be able to do level 2 English and maths also. Okay. That is also okay. All right. So she's pretty much happy with everything that she's seen. He said ILPs will send you by weekend. Okay. And contract by tomorrow. Yeah, that's fine. What about, did you send the assignments? So what we'll do today, I'll send it to you after the session, so you can start uploading. But again, the bit which I have to do in creating that is the task. One of the tasks is P4. Yeah. So the learners have to repurpose task P4 as a presentation. Yeah. They have to just draw out that from the Word document and put it into a presentation and do it. That's you make it ready. I will try and do it myself rather than having the document go back to the learners. Yeah. So we've got about 21 who have submitted so far. So we said this is do the assessment for one, see, and if it's everything is okay, then we'll start doing it for the other sets. Yeah. Okay. Okay. I'll speak to you after this. Okay, sorry, back on. So just starting with, so I think because we understand, NHS, and I think there are 2 or 3 systems that I put together in Moodle for you to look at gaining knowledge about the healthcare policy in general. But for the context of discussions that we do for covering the unit, I think what I'm going to do is pick up NHS, because for the NHS I have good knowledge, and this is a system that has good reports available, and we can put together, a good amount of understanding which you can also relate to, because you are, obviously working within the sector. Is that okay? Yes. Now, so when you look at, the background and history of NHS, what is the background and history of NHS? Obviously it came across, this was something which was started in 1948. And this idea actually, bit of a background was proposed by, the report which was done by Beveridge report on social insurance and allied services in 1952. And when it was tabled in the Parliament at that point in time, the health minister basically then, the Parliament approved it, and then it became the National Health Service sometime around 1948, after the post-World War II, time frame. Now, NHS is basically built upon, certain principles. It covers each and every one in terms of services. And when we look at this, these services are available across, England, Wales, Northern Ireland, and, Scotland. But there are small adaptations of how NHS works within each of these 4 devolved, countries. So England and Wales is normally taken up together. But when we look at Northern Ireland and Scotland, there are separate budgeting. There is a separate health minister, or separate sort of unit which basically looks after the workings and the operations of NHS within that context. But in general, it is an inclusive system which provides free health services to each and every individual in the UK, which is a British citizen, and these services are offered absolutely free of cost under this particular system, which was set up, in the early 1948. Now, it comprises of 2 broad, sections. One of the sections is within the NHS, which deals with strategy, policy, and management. That means sometimes you get to see, when you visit a GP practice or a hospital, you will see that there is a practice manager. The practice manager is basically supposed to enact out the policy and strategy which is set in general by the PCCT, which is, the trusts which manage hospitals and, GP surgeries across England, Wales, Scotland, and Northern Ireland. The second part of the, the NHS, National Health Services, basically the people who work in frontline facilities like the hospitals, the GP surgeries, the clinical care, or, people who provide the actual care required for patients. And these could be, services which are provided in the care homes, the nursing home, the old age homes, in hospitals, or various, types of GP surgeries and things like that. So 2 sides of the NHS, if you look at, one is obviously the management strategy and the policy formation, or people which work within the kind of head office. And then there are people which work within various hospitals, various other facilities, within which NHS actually physically gives out, services. So those are the ones that you have to, look at. So from that aspect, I think what we look at is this is a clear differentiation of how NHS is structured and how it was created. So you need to look at features and things in the part one or one side of the organization. It's primarily policies, procedures, and the vision and the direction. And in the second part of the the organization, it is primarily the people who provide physical care, physical, medical, clinical care, and that is done through community services, through GP practices, through dentists, through pharmacists, and the whole plethora of organizations which work within the NHS. So NHS is, if you look at National Health Service, it is totally owned, operated, and funded by the government. So when we look at that, essentially what we are looking at is, when we look at hospitals, when we look at GP surgeries, they all are funded by the budget, and that budget is roughly about, I think, 120 billion pounds every year. And through these facilities which the government actually creates, what tends to happen is that you have what you call these services provided to the individuals, and these services which are provided could be services which are first level. That means if you fall ill or if you have any problem, you first go and see the GP surgery. The GP then recommends you to a specialist or a care hospital or a care facility, wherein if you require detailed procedure to be done, that becomes the secondary line of operation. And the third line of operation is when you need specialist care. So you see a consultant actually within that. So imagine somebody having, say for example, you need to undergo, say for example, a surgery. So here the GP, which is the front line of services, would basically see the patient, concur on the fact that there is a problem and this is something which is not resolvable through medicine or medication, but requires clinical care or operation, and that is where they refer to you to a hospital, and that becomes the secondary line of care. And once the hospital decides that yes, this is something, after doing a number of tests like X-rays or MRI or whatever, decide that the diagnosis is that you need to see a specialist, and the specialist will finally recommend that you need to be operated, or this is something which is required. And that side of care then becomes third level or tertiary side of care, wherein the consultant looks at it and says, yes, I concur with the GP's decision, and I also concur with the decision given by the doctors, and that requires clinical care. That means you undergo a surgery or an operation. Is that okay?
Yes.
So three lines of services, two parts to NHS, one which is management, structure, policy, vision, and the NHS Act of 2010, and then you have the second part, which is the frontline delivery in terms of services through hospitals, surgeries, pharmacies, things like that. Community care, the word has been mentioned because a lot of these NHS services depend on community centers or people who work, volunteer, and also help in delivering some of the services to patients and people at home, and that is basically called community care. So for example, when we look at drug rehabilitation, users who have gone through the through the phase of coming out of being a drug addict, you require community care for them to be able to get back into normal society or get back into normal walks of life, and that is where people help or the family helps, or basically some of the other services which are the community services which are put in place to make sure that the person is reassured, checked, balanced, and then is going into the mainstream. And then on the other side, when you look at primary care, secondary care, and tertiary care, within the second part of services which the hospitals and the NHS provides, is you have primary care taken care of by surgeries, GPs, dentists, pharmacists. Secondary care comes in through hospitals in particular, and the tertiary care comes in through specialist hospitals, things like cancer, for example, or if you need treatment for specialist kind of diseases, that is where or conditions, that is where you will basically look at specialist care or tertiary side of care. So if I look at an eye surgeon, is that clear enough, Naima? Yeah, so I don't need to give you an example. If you look at it, if I have a child, for example, we do feel that the eyesight is weak, you go to a ophthalmologist, and obviously they do checking on the eye, and then they give you a gauge and obviously look at that, and you then go to a optometrics and obviously buy some spectacles or glasses. Yes. And after a point in time, you find that the vision is deteriorating. You again go back to the GP. The GP refers you to a specialist, and you go to an eye specialist in that case, because you find that there is a condition which is kind of deteriorating the eyesight for my child. So in that case, the consultant would, at the hospital, would recommend a surgery or an operation to treat that condition, and that would then become tertiary care. Is that okay?
Yeah.
Good. Now, over the years, the NHS has undergone a lot of change. There has been lots of changes which keep happening within the NHS. But in 2009, the Labour government basically, set out, or the Parliament actually approved an act which was called the Healthcare Act of 2009. Now, this, what it did was established an NHS Constitution. Because the NHS is a unique healthcare service anywhere in the world. When we look at NHS as a service, this is one of the most unique services anywhere across the world. Now, there are only 2 or 3 such services which are available elsewhere. One is when we study Medicare in Australia, and we look at the healthcare system in Canada. These are the other two services which actually come close to, what NHS actually provides in the UK. So, because there are lots of things which, there are lots of primary, secondary, and tertiary services, the government actually created a Healthcare Act in 2009, and this act actually put together and recognized something called the NHS Constitution, which is like a framework of policies, procedures, and rules and regulations which actually bind the working of NHS together. Okay?
Okay.
Now, NHS is also the largest employer in the UK. So this figure is slightly old, but it's roughly employs 1.3 million staff with a budget of over 90 million. Now, 90 million was in 2010-11, but I think currently, if I look at the estimates, it's probably about, closer to 120 million. So NHS is 1/6 of our GDP, or the spend that the government actually does in terms of other services. So we have defense, we have, say for example, the service sector, we have lots of other bits and pieces. But when you look at NHS, it is 1/6 of the UK government budget in terms of spending every year when we look at these services being provided to the public in general free of cost. Okay? So this is a bit of a background just to understand NHS, because we need to be looking at, understanding one of the healthcare services across, across the context of, any particular country. So that's why the focus on just understanding NHS. This particular slide gives you the, the breakdown of the staff which works. 1.36 million. How many are doctors? How many are nurses? How many are qualified, technical staff? Therapeutics nurses, things like that. Give me 1 second. 1 second.
Okay.
Hello. Hello.
Hello.
That is correct. Yes, go ahead, please. Yes, give me 1 second. Go ahead. Yes, go on, please. Yeah. Yeah. Right, okay. Give me 1 second. So yes, she's completed level 5 extended diploma in management. That's correct, yes. What is the letter that they provide? Sorry. Well, Online Tutorial College works with us as a sub-center. That's correct, yes. Yes. That is correct. They are a sub-center with us, and they are a recent addition to our side of the business. Only, I would say, 2.5, 3 weeks back, but they are undergoing the process of, the quality assurance at this moment to full-fledged center. So they will have a sub-center status, and obviously will have a certificate, and they'll be able to teach and deliver the qualifications using our teaching and learning tool. Sure. That is under process as of now. She will be receiving that before the 30th of September, because the current EQA visit is actually looking at her work for sampling and verification. No, I don't know whether you've received the letter which has been given by us. The EQA visit is currently in the process. The course has been completed on the 19th of September, and I know that obviously she's looking at. I don't know. We didn't know that obviously she's looking at taking further admission, but the course she has done with us has 120 credits that she has submitted. She has submitted 8 modules to us, and they've been marked, assessed, passed by us, and then now undergoing EQA visit. No problem. What is your good name again? Sorry. What is your name again? Sorry. Paul Star. Right. Okay. That's fine, Paul. No problem. If you need further information, I was just in the middle of the class, to be honest, and that's the reason I didn't pick up the landline and the Ramanjeet. That's correct. Yes. And if you speak to, no problem. And if you speak to Ben Jones in ATHE, yeah. Yes. That is authentic. That's fine. She's registered with us as a student, definitely Tongsu 19930. I can see her details on the portal with myself, and she's completed the course on the 19th. Her work has been submitted. The current visit, which is on, will hopefully certificate her for the full diploma. When I say hopefully, is because we have IQ'd the work and obviously it meets the criteria. So I don't see any problem of she receiving the diploma towards the end of this week or beginning of next week. No problem. Okay, thank you. Bye. Sorry, Naima, for this interruption.
No problem.
The student, which is obviously applied at the University of Bolton, and she's taken a completion letter from us, but didn't understand that, obviously the diploma is going to be available next week, but not this week. So there was a confirmation, required by University of Bolton. Sorry about that.
Okay.
So going back to, so basically this particular slide actually now gives you, what you call the breakup of the staff. Now this could, it is a changing slide because the staff in NHS, some part of it is contracted, some of them are, obviously full-time staff, but it gives you a general idea in terms of when we look at a national service within a context of a country. What we do get to see is that we assume the NHS is only made up of doctors and nurses. No, probably not. There are lots of people which work within the NHS or the national service, but they are not medical staff, or they are not essentially people who are related to medicine or any sort of clinical side of services in NHS. But you have staff which supports the working of this service. There is staff which work in the infrastructure side of things. There are staff which basically work in supporting role. Either the GP surgeries, pharmacists, or people who are required for aftercare once you've undergone a surgery, or things like that. So those are all people which are part and parcel of a national health service. So when you look at it from a context of any national health service, any country, you will see that they will always say a sum total of so many people work within the sector. But again, the breakup of the staff working within the sector is important, is because of the fact that you have the essential frontline staff, you have staff which is in the support function, and then you have staff which is doing the ancillary functions, or supporting the support functions to be able to deliver this service effectively. Now, the other bit which is important to note on this slide is that currently, what we have is about 10 strategic healthcare authorities. So we know that NHS is a big system. But within the system, what the government has done is they've created something called Primary Care Trusts, PCTs. And these PCTs manage hospitals, and there's another commission that we come across as CQI, quality, basically the care commission, which we will also look at but at a later stage. So these are trusts which manage hospitals and budgets for hospitals or surgeries in a particular area. So there are 10 such trusts which are in England and Wales. But when we combine England, Wales, Scotland, and Northern Ireland, we have about 20 PCTs which manage the entire NHS operations across UK. And they consist, they basically are the ones which basically approve the budget, hold the budget, they provide governance, they provide contractual services. Only if maybe a contractor or a pharmaceutical company wants to supply a drug, or they want to work and provide some of the services within the NHS, will have to go through a process of tendering, which will cover a bit later. But they will have to go through this process to be able to get empaneled. And once they become an empaneled vendor, then and only then, once approved by the PCTs, can only they supply services or provide services within NHS. Is that okay?
Yeah.
Okay. Now, going further, when we look at some of the other bits and pieces related to this is now NHS does not work alone. So let's look at what are the other pieces of key critical institutions which support the working of NHS. One of the key other institutions which works on the policy side, on the strategy side, and also looks at audits to a certain extent is the NICE, which is National Institute of Health and Clinical Excellence. Now, this is a body which was established in 1999, and what we looked at was why this body was established is that with the changes which are happening, there are three basic changes that we see happening within our populations. One is we're all living longer. Second, we're all living longer, but what we do see is there are new types of conditions which are coming up, which did not exist maybe 20 years, 30 years back. And the third thing that we look at is that a lot of clinical drugs which are available are becoming resistant. The bacteria and the viruses are becoming resistant to those drugs. So what happened is, because of the changing regulation which the NHS has from time to time, this particular institute was established to become a body which is going to be responsible for developing guidelines and standards across for delivery into the NHS, infrastructure and framework. So they look at, I think there is something called the FDA, which is the Food Development Authority. When you look at in the US equivalent, wherein they have to approve every drug or every sort of thing which is sent into basically mass consumption, they have to approve of this. So Nhs as a body in the UK kind of approves approves and sets the standards for anything to be incorporated or used by NHS and then delivered onto patients or people in general for consumption. They include medicines, they include procedures. For example, when you are undergoing some sort of a surgery or undergoing some sort of the documentation of the procedure, how it has to happen, when it has to happen, how long will it happen, who all will be involved, is all documented and as a policy and procedures created by the Nhs. They oversee such operations. So if you look at incorporation of new medicines or new health drugs which are coming in after trials, they have to be approved by NIAC Nhs first before they can be made available to patients getting services from the NHS. Is that okay?
Yeah.
And the third, when we look at the third bit, so you have the Health, Act of 2009, you have the NICE, and the third bit that we look at is the NHS also developed, which is something called the National Institute of Health Research. Now, this particular body has an independent budget from the government, and this body looks into doing research, which are, basically developing, or collecting information and developing policies and procedures for areas for which there could be requirements in the future. So this is like a research facility within the NHS, which has its independent budget. It's an independent body, and it looks into all probable, cases or all probable things which can affect the national service, or if they need to reshape the national service. This looks at from an angle of long-term future. And here is where the research is carried out. For example, maybe to a certain extent, testing of medicine, clinical procedures, all those when they are tested, approved, and finally perfected, are then introduced into the national service. So this is a third body which basically is a part and parcel of the NHS framework, but works with the NHS to basically make the NHS better. And it looks at problems, issues, things which NHS can encounter in the future, and that is where the research and development is done through this particular body which has been set up. A parallel would be if any organization like Unilever, they come out with a lot of products every year, like a new detergent or a new soap, but they have done a lot of research and development internally. So the R&D department of the Unilever, which produces or comes out with new products and services, is very similar to the NHS or NIHR within the NHS, which does the similar function. Is that okay?
Yeah.
Now, in terms of, so basically going back and summarizing, so what we need to look at is in task 1.1, we are looking at understanding what is healthcare policy, how it works within a particular context, and what we've looked at now is NHS, which is the National Health Service within the context of UK. The background, and to a certain extent, what we've also looked at is the understanding of what type of services it provides, what are the different types of organizations which support the National Health Service, and to a certain extent, we've understood budgeting, we've understood the number of people which work within this particular sector, and what kind of services it provides. Okay. Now, the other bit that we need to look at is, how does NHS get funding? How do they get funding?
From the government.
Yeah, that is fine, but from the government. But what part of, do you fund the NHS?
No.
No. Okay. So this is what you said is absolutely correct. The government does the funding, but I think ideally, what I want to go back a bit further is that the government gets the funds from where? The government collects money from individuals, people which work within the country, and they get it from taxes.
Oh yeah.
Right.
Yeah.
So they get it from taxes, levies, or contributions.
Mm-hmm.
That is correct. So the NHS is essentially a service which is funded by the government, but the funding for this service actually comes from the core budget of the government. But where does that come from? It comes from taxes, national insurance contributions. And when you look at a parallel here that I would suggest is, if you look at the council tax bill that you pay, right? Every month you pay a council tax bill. The council tax bill gives or provides allocation to basic services which the council provides in your area. So services like the fire service, services like police, services like community servicing, and the community police officers, the basic infrastructure of the basic services of maintaining the infrastructure of water, gas, electricity coming into your house. So the breakup of the council tax budget is also something that you get to see, and that budget is basically, why does they say that share that in transparency, is because after all, it's public money, and public is contributing towards the public money is contributing towards the creation of this overall budget, and this overall budget then helps the council to deliver these services back to the community. So similarly, the NHS is funded by the government. It's 1/6 of the the spend that the government does in the UK, which is about, I think our GDP is 2.23 trillion dollars. But when we look at that, if you're looking at the spend which we are doing in the NHS is roughly now this year closer to 200 billion pounds, and that is roughly $350 million. So when we look at it, it's about 1/6 of the size of our GDP in terms of the government spending, and that spending, part of it comes from our national insurance contributions, from the taxes that the government raises, and the contributions it gets from other levies and other bits and pieces like VAT and others. Okay?
Yes.
Clear enough?
Clear enough.
Okay, good stuff. Do you want me to go on, or do you want me to stop here?
I don't mind if you, because I'm free until 3 o'clock.
Right. Okay, that's fine. As long as time is fine, but as long as you're able to understand, and is it? I hope it's not becoming too heavy. That is my question. So that's okay. So I'll continue. So basically, the third bit that we need to look at when we look at now the healthcare policy in a particular context, let's understand that for NHS. Now, there is something called Section 242 of the NHS Act, because the government created a Healthcare Act in 2009. In that act, there are lots and lots of pieces of legislation which basically, become kind of rules and regulations of how the NHS has to provide these services through its operational structure, or which is the PCT, the primary care trust. And for that, what I'm going to do is just open up a chart to show you something which will, I think, put it in the context. Sorry. So this is an additional, presentation which I'll send you for you to just have a look at, in terms of just to understand how NHS has, kind of moved across the years, how it has changed across the years, and what is the new structure of NHS which looks like. So if I look at, the NHS or the Healthcare Act, and when we look at this particular structure, so the NHS, we have a National Health Secretary, or basically, who's that person? Jeremy Hunt. He's the Health Secretary. Jeremy Hunt is at the top, and he's responsible for ensuring that the NHS delivers frontline, primary, secondary, and tertiary services to each and everyone within the UK who's a resident of UK. So he's the person at which the buck stops. Underneath that, you have the Department of Health, you have the Nhs Act, and then you have the regional offices. When I say is, you have regional offices of the government, which basically monitor all the activities of the healthcare department. And underneath that, you have the 20 NHS or PCC trusts. You have healthcare authorities, and we'll come to the question of authorities. And then you have the care groups, and in certain places you also have authorities which contribute towards or work in tandem with the healthcare services. So local authorities could be Hair Council, for example. Some part of your council tax budget might go towards your GP surgery in the area, or might go to the hospital or the infirmary where you are in that area, and that also contributes towards the funding of that particular service within that area. So here, when we look at in particular, this is how the structure of NHS is currently, in terms of how the management works, who reports to who, and that's the structure. If I look at in 1997, the total funding for NHS, which consisted of all this, basically the funding of 267 billion, which was given out to health. Some part of it came from local government. This is a breakup of, for example, the UK GDP, and we are looking back at 1997. Today, the GDP is 2.2 trillion, but I'm looking at 1997. So there, at that point in time, the UK economy was turnover of UK economy was 267 billion. And out of that, if you look at health, it's a large chunk. It was 1/6 or 1/7 of the total budget, which actually spent on, the NHS. Is that okay?
Yeah.
So, and one other thing which I'll bring in for you to understand, this is a great handout which I'm going to send to you, which basically will help you in doing the assignment, because I think 9 out of 10 cases what I looked at is a lot of learners will actually pick up NHS as a system to be able to do the assignment. Okay. So this particular handout will give you, it's a 3-page handout, 4-page handout, but this handout will give you a brief background about NHS. And it's a very good reading article for you to look at in terms of the bits and pieces that you see that I put out in the presentation and actually from here. So how did the NHS Act came about? What is the NHS Constitution? What are the functions of the NHS Constitution? What are the other bodies which actually support NHS in terms of the role of PCTs? And here, the breakup of staff, which I picked up from here. So this is a good read that I would suggest just do a bedside reading of this particular article, so that it gives you more insight into, what the NHS is, what kind of challenges the healthcare system is facing in the UK. And I mentioned them briefly, things like, we are facing a biggest challenge is that we are all living longer. So we need care longer periods, especially during the old age. What are the various problems that we are facing in the modern healthcare system? It is not the diseases, not the conditions, but conditions like diabetes, conditions like cardiovascular diseases, cancer. These are real threats where the budget of NHS is currently being utilized. So this is a good, read for you to look at, and this is the structure of NHS in a bit more detail, for you to look at if it's of interest. So I'm going to try and send this out to you, and I think you'll probably get a sense of, how the whole organization is structured.
Okay.
This is a good chart to look at. Sorry. If I look at this particular chart, this gives you the full structure of the NHS across Wales, England, Scotland, and Northern Ireland as a snapshot.
Okay.
So if you look at the 12 regional offices, and they are divided into 152 primary care trusts just within England. So you have Parliament, you have the Secretary of State, Jeremy Hunt, you have Department of Health, and then you have the regional offices of the strategic healthcare authorities. They manage all the strategic rules, regulations, functions of NHS in England. And then they are further managed into or broken down into the primary care trust, which manage hospitals, clinics, surgeries, all the other areas from which you derive services or frontline services, clinical services. And then the PCTs are made up of GP surgeries, which is the biggest component. You have hospitals, you have mental health trusts, you have ambulance service, you have independent sector or private sector essentially. There are private providers like doctors which are registered with the BMA, British Medical Association. You can work privately as a doctor prescribed, and they form a part of something called the independent sectors or independent providers. And then you have the NHS Foundation, which monitors the entire operation. And then there is another thing which I mentioned to you earlier, like CQC, Care Quality Commission.
Yeah.
This as a commission was put together, in the early 2000s, and this now oversees or has the authority to be able to get rid of any hospital, any surgery if they do find that the budgets are not being utilized properly, the services are not being provided, or the standards which they set are not being met. Then they can strike off any hospital, any surgery, any provider off the list wherein the funding can be withdrawn. So they are like a police or a medical police, which basically sets the policies and guidelines, but also monitors it, does the audits and checks, and ensures that the services which are required to be delivered, created by the NIHR and created by Nhs, are actually followed while delivering these services within the, the hospitals and the care trusts. And a similar structure is obviously there for NHS Wales, slightly devolved, but slightly smaller depending on the geography. You have Northern Ireland, and then you have Scotland. So this is something I'll send you after the session today, and it should be a good read for you to look at, just to understand how the NHS is structured within the UK. Okay, good stuff. Now,
we can use that one as if we want to put an example on the.
Yes, definitely.
Yeah. Okay.
This is something that you will maybe use. This particular handout is something that I think you will use to do your assignment for LO1. You can pick it up. It's neatly referenced. As long as you're referencing as it is referenced here, I think you should be able to pick this up. And you should. This article you will use in two locations. One is when we are covering LO1, and the other is when we are looking at challenges and contemporary issues in the NHS in the further sections. So some bits of this in terms of the handout will be useful because it will help you summarize beautifully what are the challenges which the healthcare system is facing in the UK in particular. You'll be able to pick it up from here and elaborate.
And 5.3, huh?
Yeah.
Okay, contemporary issues. Okay.
Right.
Okay, contemporary issues. Okay.
Yeah, come to that in a bit later. Now, what we are trying to understand on this slide is that, within the NHS, once we understand the overall or the overview of the structure, there are other, pieces in the NHS which basically help deliver the service, patient care in terms of the overall experience. And there are lots of ways in which the government actually collects feedback or data from the patients. So there is in particular something called the Picker Institute, which actually is responsible for getting patient-related information and feedback on how has their experience been getting these services. So as a patient, when you go to the GP surgery, if you're not happy with it, what do? You ask for maybe, if you're not happy with the level of service which you are getting from your GP surgery, you would probably raise it as a complaint. That complaint, might be picked up by the practice manager in the surgery, and they will try and resolve it. If it does not get resolved, then it will be escalated further. And then at some stage, what will happen is an external body gets involved, and that external body will get into investigating it. Why is the reason that you are not happy with the service or you've not received the desired level of service? So this, if you look at on a bigger scale, is by an independent body set up, which does annual surveys to get data from patients in terms of their experience of receiving care from NHS or a particular branch of NHS or particular service of NHS. And that particular body is called Pickers Institute, and they publish annual surveys and research reports which basically say that let me bring this to you now. Maybe a couple of months back in the news, there was, if you watch BBC News, there was something in terms of discussions that the response time with the A&E are increasing. The wait times are increasing. So what happens is there is 4-hour, 5-hour wait for patients at the ATHE departments, and there is a set specific procedure within the NHS is that you need to be looked into as a patient within 2 hours of the arrival of within the hospital. So if you have a acute problem, you ring up the ambulance and service. They pick you up from a place, they bring you to the hospital, and the NHS Act says the patient needs to be looked at within 2 hours of being present in the hospital. But of late, Jeremy Hunt came under a lot of pressure when the statistics for A&E department for some of the regions in England and Wales were published. And they said that the wait times in Wigan, in Wales in particular, was up to 7 hours in the A&E service to receive patient care. And that was unacceptable. So this data, is picked up by Pickers Institute, an organization which works within the NHS, but also looks at picking up vital pieces of information, and then they do surveys and, they pick this up. And this is something which is an end result of, information being picked up in terms of feedback from patients to say that, I do get the service, but the service is not meeting the benchmark or the criteria set. And that is where the government then puts an action plan into place, or, puts a team in place to manage the situation to say, okay, we need to bring it in line with what the expectations are or what the NHS Act actually says, for this line of service. There are other bits and pieces that we look at, which is services like PALS, patient advised license service. So if you're unhappy with the service that you've received, you can go in and seek advice, independent advice from this particular kind of an organization, which is a part and parcel of NHS. And you can also get involved with something called local involvement networks that support patient feedback and care. So if you're not happy with some of the services being provided in the community, how do you put that feedback back into the system? You use some of these services like PALS and links which work within the NHS to take your word up to the right and relevant people, for them to be able to feedback into when the policy making or revision of policy making is happening as far as NHS is concerned. Okay. Now, similar is the structure. When we look at, because we've gone through the chart, similar is the structure when we look at in Scotland. Obviously, what they've done is they don't call it the Primary Care Trust (PCTs). They call it the NHS boards. So in Scotland, because it's the devolved government, they get the budget from the Parliament, and what they do is they prescribe some part of that budget to go to the NHS for providing these services to people in Scotland. They do not have PCTs; they have something called NHS boards, and these boards are equivalent to what the PCTs do is in terms of setting the direction and managing the review and performance of the hospitals, GP surgeries, and things like that.
Sorry.
No problem.
I think. Hello. I'm home. Come home straight away. Yeah. Okay. Walk with me. I was busy home. Okay.
No worries.
Come home. Yeah. Sorry, that's my son is walking.
All right, no worries. So in Wales, you have something called the National Delivery Group (NDG), and obviously, they've replaced something called PCT. So obviously, in different regions, devolved regions, there is a slight bit of differentiation in the structure of NHS, and that is what is highlighted on this slide. Now, what we want to be able to do is, I think from my context, for today's session, what I will do is, yeah.
Hello? No, come home straight away. I'm busy, though, okay? I'm busy. Come home straight. Sorry for that. Okay, sorry.
What I'll do is I'm going to stop here, because what I've looked at is LO1 in particular, 1.1, 1.2, 1.3, and you go through the slides at your own end, at your pace, and then let me send you this handout. Study this, and then understand in terms of how the NHS came about, how it works, how it is working in the 4 devolved geographies, not England, Scotland, Northern and Wales, and then understand the key bodies which help shape the healthcare policy for NHS. The National Institute of Health Research, the National NIC, which is National Institute for Health and Excellence, and last but not the least, when we look at how does it get feedback into the system through the Pickers Institute, the Healthcare Act, and the Nhs Constitution. So look at all this, and that will, give you some sort of understanding in terms of how the National Health Service works.
Yeah. Okay.
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 I'll send you the additional handout on NHS and the additional presentation. The NHS presentation is slightly old, but it is to give you some context in terms of background of NHS, in terms of how the NHS was, how it came about, what it does, services it provides, the staff breakup, and things like that. This is just for understanding, and I think it might be useful when you do the assignment.
Okay.
Okay. So if I have to ask you, what does NHS do? You have 2 or 3 simple bullet points. Things like it provides free medical care at the point of use. It is for rich and poor alike. It provides medical services in accordance to your needs. So this is NHS. Now, what is the NHS Constitution? NHS basic constitution consists of 2 things. The NHS serves those who need care, primarily on any sort of care, medical care, clinical care, whatever it is. And it also provides support to people when they need it and how they need it. So it is at your home, at the hospital, at the surgery, at the place of your work. It works in, to provide holistic care. And it could be from any place of, work that you do. So this bit gives you a bit of understanding of how NHS was in the early 90s and how it is shaping up now, after the creation of the Healthcare Act, and also the creation of, the 3 main bodies which have come about in the early 2000s.
Okay.
Good stuff. So next week, the same time in terms of the session, which is 10:30, if that's okay. And then what I'm going to do is obviously email this to you so that you are able to go through it at your own pace. If you have any queries and questions, feel free to come back to me by email or phone.
Okay.
Okay.
Lovely.
Okay.
Yeah.
Thanks, Diamond. Thanks for joining me today.